Food is medicine. We say it, we hear it, we post it on social media, but somewhere along the way, we forgot what that actually means. And it's really costing us, not just in the obvious ways like heart disease or diabetes. Yeah, we kind of all get that, but in ways that people are not warning you about: brain fog that makes you feel like you're thinking through molasses, fatigue that coffee can't touch, hormones that feel out of whack, and chronic pain that becomes a daily companion. Welcome to the Medical Disruptor, a place where well versed women can ask the hard questions and get evidence based answers that you won't find anywhere else. Our community is always informed, empowered, and science backed. I'm Dr. E, the MP with a PhD, and I help smart, well versed women go from medically gaslit to medically empowered. On solo episodes is where I dig into one issue at a time. And then when I have guests on my episodes, that's where I sit down with clinicians and expand past their training. And today, we're talking about one of the biggest blind spots in modern medicine: the systemic separation of food from healing. What's happened is that we've been conditioned to think of food as fuel and medicine as treatment, right? Like two completely separate categories. When you suggest that your migraines might be connected to what you eat, or that your joint pain can improve by changing your diet, you're often met with skeptical looks and dismissive responses. And I know I cannot tell you how many of my patients, when I used to take patients one on one, would tell me they'd go to the rheumatologist and say, listen, when I took sugar out, my arthritis got better. And they'd be like, okay. They would say, there's no evidence for that. And as long as your labs look fine, it was some variation of it's probably just stress or your weight, right? So there is this dismissal that we can use food as healing. Now, this isn't just medical oversight. It's a fundamental misunderstanding of how your body actually works. This isn't just a medical oversight. It's a fundamental misunderstanding of something critical in your body. Your body doesn't recognize this artificial boundary we created between food and medicine. Every bite that you eat, everything you put in your mouth, whether it's a medication or a french fry, it sends a biochemical signal that either promotes healing or drives inflammation. Every meal, every drink is an opportunity to either support your body's repair mechanisms or undermine them. This is a really big thing. So to say that food doesn't affect or can't be used as medicine, it makes no sense. So today, let's dive deep into the science that shows that food isn't just about calories. It's not just fuel. It's about cellular communication. We'll explore why your symptoms might be your body's way of telling you something about your diet that conventional testing can't capture. And we'll give you the tools to start using food as the powerful medicine it was always meant to be. Because once you understand how food works in your body, it's not just about disease prevention. It's not just about not getting diabetes. It's not just about not getting heart disease. It's about reclaiming your power to heal in a system that too often tells you to stop asking questions and just accept that it is what it is. Now, let's start with some numbers that maybe will make you pause. Maybe they're not surprising to you, but research published in the Lancet says that poor nutrition contributes to 11 million deaths globally each year. In the United States, nearly 900 people die every single day from diet related diseases: heart disease, stroke, type 2 diabetes. Kind of not surprising. Maybe the 900 a day is surprising, but you kind of all know that food related, diet related diseases like heart disease, stroke, type 2 diabetes, these people are eating their way into disease. But here's where it gets interesting from a medical gaslighting perspective. We accept that food plays a role in heart attack and diabetes, right? The research is overwhelming. The government has issued guidelines and insurance companies have recognized these connections. But the moment you suggest that your depression, your chronic fatigue, your autoimmune issue, your hormonal chaos might be connected to what you eat, then suddenly it's unproven. Suddenly you're being a quack, you're being dramatic. It's stress, it's in your head, right? So food can cause diabetes and heart disease, but food can't possibly cause your depression or your fatigue or your autoimmune issues. Like that doesn't make sense, right? The selective acceptance reveals something crucial. We've been trained to think about food's impact in a really narrow way. And if it doesn't show up in some basic blood work, like your sugar's elevated, your cholesterol's elevated, then it doesn't fit into a clean diagnosis. Then it's dismissed as coincidence or it's in your head. But the research on food is there and how it affects and impacts your body. The disconnect isn't because there's a lack of evidence. There's plenty of evidence there if you want to look for it. The disconnect is about medical training. So medical training, I just want to double down every time I say this. This is not a space that's going to bash doctors or NPs or PAs. I am an NP. I have been classically trained. My friends are doctors. So this is not a doctor bashing space, right? And I say it every time, but I just always want to surface it. But the reality is that the average medical school provides fewer than 20 hours of nutrition education over 4 years. So they're educated and they know a lot of things about disease and how to manage disease. There's no question. I will not take that away. But there is no conversation or education on nutrition. It's literally less than half a day of training on something that every single patient does at least 3 times a day, eating, putting food in your system. And yet the medical training doesn't have it. So it's not because of lack of evidence, it's lack of it being in the curriculum. Most doctors, nurse practitioners, physician assistants graduate knowing how to prescribe medications, but not how to use food therapeutically or recognize the subtle ways that dietary choices manifest as symptoms. And then when patients come in and they're connecting the dots like, hey, when I eat this, I feel foggy. When I do that, my joints hurt. They're going to get a response that says there's no evidence for that. Not because the evidence doesn't exist, but because they weren't trained to recognize or evaluate it. So this creates a perfect storm, right? Patients are experiencing something real and measurable and trackable. When I don't eat sugar, my joints don't hurt. When I don't eat gluten, my skin is better. When I don't have dairy, my eczema goes away. Real, measurable changes. But providers who lack the framework to understand it will not validate those experiences. And that creates a storm, the perfect storm for medical gaslighting. Unintentional medical gaslighting, because again, they just never learned it. But this space is for you to understand that it is okay if it is not validated. Your experience is still valid. Let me give you a story about a patient. And this patient suffered from daily post-nasal drip as far as she remembers her entire adult life. And by the time she got to me, she's tried everything. She's been to allergists, they all came back normal. She did sinus imaging, completely clear. And her PCP just said, it is what it is. Some people just have post-nasal drip. But it was really affecting her. I mean, she was someone who was a public speaker, and she kept having to clear her throat. That you can imagine that that's not a fun thing to listen to in a public speaker. So she did everything right, and her primary care did everything right, right? That primary care and the allergist and the ENT did everything right. Imaging, testing, they left no stone unturned. I have no complaints against them. They did everything right. So what we did is we removed dairy from her diet. Now, it doesn't make sense because she was not allergic to milk. Her allergist did not say that she was allergic to milk. But we know anecdotally, hate that word because it's not really anecdotally, that many people are kind of intolerant to dairy. It doesn't show up in gastric issues. Their belly's fine, but they will be more mucousy. So remove dairy from her diet. That's it. We didn't put her on intermittent fasting. We didn't remove gluten. We just removed dairy 100% from her diet. And within 2 weeks, the post nasal drip was gone. She does not need allergy medications and she is done. This is not luck. This is not a placebo effect. This was physiology in action, right? Because for her, her body was reacting to it, not in an allergy way, not in a way that the allergist would find, but in a way that was certainly affecting her life. Basically, for her, dairy created an inflammatory cascade. Now, notice how many times I said for her, because I'm not saying that everyone reacts this way to dairy, right? But for her, she did. Dairy contains some proteins called caseins that for some people can trigger an immune response. These proteins can cross-react with tissues in the respiratory tract through a process called molecular mimicry, and the immune system starts to mistake it for a pathogen, something harmful. So then immune activation triggers a reaction. It could be histamine, it could be other inflammatory mediators. The bottom line is it creates this low grade inflammation that inherits sinuses and nasal passages, which creates persistent mucus production. Her body is reacting to this dairy in a way of creating mucus production. The crucial point here is that for this patient, her body was giving her clear information through her symptoms. Her daily postnasal drip was a signal that something she was eating regularly was triggering an inflammatory response. But because it didn't fit into the standard allergic categories and the testing was normal, her pattern was dismissed rather than investigated. And that's okay. We are not here to change your provider's mind. We are not here to change the system. We are here to validate your experience and to give you the science behind why it's happening so that you can get on with your life, okay? And can go from medically gaslit to informed and medically empowered. Food is information. Every time you eat, you are sending your cells a specific molecular instruction. Your food is code. That's all it is. It's code. So carbohydrate is a code, and fat is a code, and protein is a code, and vitamins are code, and the colors of your vegetables are a code. And guess what? Doritos is a code, not a good code. And donut is a code. It's not a good code, right? And these codes, as you eat them, it's not just calories, it's data. And your cells are constantly receiving and responding to the chemical messages in your food. And for that patient, when she ate dairy, it created a code for her that said, release mucus, even though the test didn't show an allergy. Okay. She removed it and it was gone. Now, if you're on this podcast, you already know what the microbiome is, right? It's this world that lives inside your belly of good bacteria and bad bacteria and viruses and protozoa and the whole world that lives inside of it. It's an ecosystem of bacteria that lives in your GI tract. And there are some good ones that produce neurotransmitters and regulate your immune system, and they create vitamins, they influence your mood and your energy. And what you eat determines which bacteria thrive and which ones struggle. These bacteria need food. If you're going to feed it sugar all day long, it's going to increase the population of certain bacteria that are not the good ones. And if you eat fiber and vegetables and proteins, then you give the food to the bacteria. Think of it as feeding the fish. Okay? You have to feed the fish that you want to survive in your microbiome fish tank. In 2019, a randomized controlled trial published in Gastroenterology followed 200 people who changed their diet to include more fermented foods and diverse plant fibers. Within just 4 weeks, participants showed significant improvements in microbiome diversity. That means that there was more different populations inside the belly. You don't want to have just the same populations there. You want diversity. Reduced inflammatory markers, and they reported improvements in energy, mood, and cognitive clarity. Okay, if you saw the episode on Alzheimer's I just did, here's what it is. Cognitive clarity also, just by changing the food. Not by adding a medication, just by changing the food in 4 weeks. These participants were not taking probiotics or supplements. They were literally just feeding their existing bacteria different information through the food choices, and their internal pharmacy responded by producing different chemical output, right? So if you feed the bacteria that's in charge of neurotransmitters, you're going to have more neurotransmitters. So that's the idea of using food as code to feed certain bacteria. But there's another level, which is mitochondrial function. Mitochondria is the powerhouse of the cell, right? Let me tell you about another patient. This is a classic patient. You've heard this, you might feel this. We've all heard this type of patient coming in exhausted, even though her labs are normal. And she was sleeping 8 to 9 hours, but waking up exhausted with afternoon energy crashes and struggling with brain fog, right? This is the classic. And her conventional workup was completely normal. Thyroid function, complete blood count, comprehensive metabolic panel, even her vitamin D was good. So her primary care said maybe she was depressed and assumed her fatigue was mood related. Now, I want to say this, not mad at the primary care. Primary care did everything right. I mean, did every possible test. So I'm loving her primary care for being so thorough. Really important here. We're not going to vilify your PCP. I love your PCP. I wouldn't take on a patient if they didn't already have all those things done, right? So it's really important that they did that. And I can understand why they suggested antidepressants, not my jam, for this type of situation. But if you have someone whose labs are normal and they're constantly tired, that's the criteria. It's one of the criteria for maybe you're depressed. So I could see how they got to that conclusion, okay? But this patient said, I really don't feel depressed, even though I kind of matched that, and decided to come see me. Again, this is when I was seeing patients one-on-one. And so we dug a little deeper into her cellular energy production, and everything made sense. Jennifer's fatigue wasn't psychiatric. It was mitochondrial. Every cell in your body contains mitochondria, hundreds per cell. These organelles take the food you eat and convert it into ATP, which is the energy source. Now, the mitochondria function the best when there's not a lot of inflammation and when you're metabolically flexible, meaning you're in and out of ketosis, in and out, think of intermittent fasting. If you don't know what that is, grab that episode about intermittent fasting. When your diet is high in processed foods, refined sugars, and industrial oils, guess what? It creates stress, which creates high inflammation, and it damages your mitochondrial membranes and impairs their ability to produce energy efficiently. A 2018 study in Cell Metabolism showed that people eating high-processed food diets had measurably reduced mitochondrial efficiency within just 2 weeks. Their cells were working harder to produce the same amount of energy, leading to the fatigue, brain fog, and mood changes that this patient was experiencing. So, what we did with this patient, we shifted her diet to support mitochondrial function. We added healthy fats, antioxidant rich berries. We did add some intermittent fasting in order to give her mitochondria a little bit of a boost. And within 6 weeks, she reported dramatic improvements in energy, mental clarity, and overall vitality. Notice I didn't say I put her on supplements. I didn't give her a protocol of supplements, not against supplements, but that's not where this lives. We are talking about using food as medicine. If you're going to eat processed food, you are not giving yourself medicine. You are giving yourself poison. The insight here is that, again, this patient's body was giving you clear information through her fatigue. Her fatigue was the symptom, and it was not in her head. She was not depressed. She was not sick enough for her labs to be abnormal. Her labs were fine, but the fatigue was reflecting a real dysfunction at a cellular level that standard lab testing couldn't detect. So we talk about how food affects neurotransmitters, and we talked about how food affects mitochondria, which gives us energy. But food could also affect inflammation, right? And if you have anything going on in your body that is responding to inflammation, right? You have any type of rheumatological issue, you have arthritis where there's flare-ups, right? That's inflammation. And if you have those symptoms, you're in a constant state of chronic inflammation. So that could be your inflammation could show up as fatigue, brain fog, joint pain, hormonal imbalances, skin issues, mood changes. My skin's good today, and it was bad yesterday. That's a flare up. That means yesterday you were inflamed, right? And food is either the driver of that inflammation or it can be the tool to help resolve this inflammation. That's a big one. This was actually the first thing we discovered when I went into this with my wife and her autoimmunity. Because with her, all we did was change her nutrition. This is years ago, and her autoimmunity was completely gone. Food drives inflammation. When you eat processed foods, your body's immune system takes this information and interprets it as a threat. Ultra processed food is not food. It's just a bunch of chemicals that don't exist in nature. And your immune system, which evolved millions of years ago, it did not evolve in the factory. It did not evolve to recognize these things. What it does is it mounts an inflammatory response to this food. It doesn't recognize its code. So it starts to create inflammation. So that's one way how processed food activates inflammation. But the other way is that when we eat high sugar foods, it triggers that rapid insulin spike and lows, highs and lows, which also activates inflammatory pathway. So we have many ways in which processed food, high sugar foods activates the inflammation. A landmark 2017 study published in Nature Medicine followed 1,000 people over 2 years and found that those who eliminated processed foods and focused on anti-inflammatory dietary patterns showed significant reductions in systemic inflammatory markers like C-reactive protein and interleukin 6. What that means is they just took a bunch of people and changed their food, and they were able to measure the markers in their blood, C-reactive protein, interleukin 6. Again, without taking anti-inflammatories, without medication, without supplements, just changing the nutrition, overall reduce inflammatory markers in the blood. This is a really big deal, and by itself is not enough because these biochemical changes also correlated with symptom improvements. The patient said they felt better energy, clearer thinking, less joint pain, improved mood stability. Food and inflammation are tied. Now, again, conventional medicine knows that food is related to disease, right? We said diabetes and heart disease. There was a hospital, a healthcare system, the Geisinger Health System in Pennsylvania, that launched something called the Fresh Food Pharmacy. They spelled pharmacy with an F, and they started integrating giving their patients fresh food, for the high risk patients, fresh food. One of their patients, a 58-year-old man living below the poverty line, this is somebody who usually cannot access fresh food, struggled with advanced type 2 diabetes. He'd already lost a toe to the disease. Despite multiple medications, his blood sugar remained high because he was eating fast food and shelf-stable food, right? Not by choice, but a necessity. Traditional medicine had essentially given up on him. They maxed out on all the meds, and he was just headed towards more insulin, more amputations, more complications. Then he joined the Farmacy program. Each week, he picked up boxes of fresh vegetables, fruit, lean proteins, and whole grains. And he worked with registered dietitians who taught him how to prepare the foods and how it affected his blood sugar. The results were remarkable. In 18 months, he lost 60 pounds. His hemoglobin A1C, that's his sugar number, dropped from 10 to 6.8. And he was able to reduce his medication dosages significantly. And of course, he gained a sense of control over his health. So when this hospital invested in this program, it actually reduced complications and admissions into the hospital. Now, this is an understanding that food functions as medicine. all the medicine on this man's list could not overcome until he changed the food that he was eating. And we understand it, right? The Geisinger program documented similar results across thousands of patients with measurable improvement in diabetes control and blood pressure and healthcare costs. Because it turns out that when you feed people good food, their healthcare issues come down. But again, somewhere along the way, if we use that same logic on other diseases, conventional medicine says no. So I'm here to tell you that food is information, regardless of whether we're dealing with diabetes or autoimmunity. Remember, your symptoms are information. When you experience brain fog after certain meals, joint stiffness that comes and go with dietary changes, energy crashes that seem to follow eating patterns, mood changes that correlate with your food choices, your body is communicating with you. These patterns are not coincidences and they're not psychological. They're your body's responses to the molecular information that you're providing through food. The tragedy is that we've been conditioned to dismiss these signals as unreliable or unimportant unless they show up in a lab. But your lived experience of how food affects you is more sensitive and immediate than the biomarkers in the labs that come later. Okay. By the time you get diabetes or an issue, that's late stage. When you notice these connections and are told there's no evidence for that, what's really being said is there's no evidence that fits into our current framework. That does not make your experience less real or less important. It just makes our diagnosis incomplete. The aha moment that I want you to get from this podcast is that food is not just fuel, it's information. Every meal you eat sends molecular signals to your cells that either promote healing or drive inflammation. And your body is communicating with you through your symptoms, energy levels, how you feel after eating, joint pain. Listen to your body, even if the labs are normal. When you notice patterns between what you eat and how you feel, that's not wishful thinking or being overly sensitive. That's your body's sophisticated feedback system working exactly as it's designed to. Your experience of how food affects your symptoms is more immediate and more sensitive than the labs that don't catch it. All right, what are your immediate next steps? First, subtract before adding. Before you start adding more food or supplements, remove the inflammatory food. Pick one. Pick one that you eat regularly and remove it for 2 weeks, right? The most common ones are anything that's processed with a long ingredient list of things that you don't have in your kitchen cabinet. Foods with added sugars or dairy if you think you have a sensitivity. And pay attention to how you feel. Notice your energy levels, your mood, your digestion, your sleep, and any chronic issues you're experiencing. Second, keep a food journal. I know it's annoying, but it's really big. Make a list of all your symptoms, even the ones that don't feel like they're connected. Your depression, your anxiety, your joint pain, your post-nasal drip, your itchy skin. They don't seem connected. Just write them down and see what happens once you remove that big inflammatory food. Just see what happens. Maybe nothing happens, but maybe one thing happens. All of it matters. And then, so if you can, keep subtracting more of the inflammatory foods. But then after that, consider adding anti-inflammatory foods. Maybe a handful of berries, a serving of leafy greens. You know, I love to make a smoothie, put it all in the smoothie so you can just get it done in one drink. Maybe a tablespoon of extra virgin olive oil, some nuts. Small, consistent additions create momentum and give your body the tools it needs for repair. And fourth, I say this now every time, when you come to discuss with the healthcare providers, connect the food patterns to your health concerns. So instead of saying, I think gluten bothers me, you could say, I've noticed that when I eat wheat containing foods, I experience joint stiffness and brain fog within 2 to 3 hours. And this pattern has been consistent over several weeks, right? That's very different than I'm bloated all the time, every time I eat, right? So let's get specific. Why? Because medical professionals are trained to hear things this way. That is the language that they speak. When this happens after X amount of time and has been consistent or not consistent. It's really important to present our case in a way that our medical community understands. You would not go into someone who speaks another language and insist that they understand your language. You would try to communicate in their language. Right now, I'm not saying that they're magically going to necessarily listen to you, but it might make a difference and it might make them, even if they can't solve it, it might help them advocate to help you find someone that can. So try to use their language whenever possible. So the timing is important, the reaction is important, and using that language is important. Instead of this generalized, I don't feel good all the time, my stomach is always bloated. That's not going to get you anywhere. Bottom line, we've been systematically trained to separate food from medicine, but your body doesn't recognize that artificial boundary. Food is medicine. Anything you put in your mouth is going to have an effect. Food has molecular information that your cells use to make decisions about inflammation, energy production, hormones, immune function, everything. The research is clear. What you eat directly affects how you feel, how you think, how you function. When you experience connections between your diet and your symptoms, you're not being dramatic. You are recognizing cause and effect. Start where you are, trust your patterns, start using food as the medicine it was always meant to be. Your body has been waiting for you to listen, and now you know how to hear what it's saying. And with that, we've come to the end of another episode of the Medical Disruptor. You're now part of a community that doesn't exist anywhere else. A safe space for women who want real scientific information, but also want a safe space to ask questions without being made to feel crazy. Our community is informed, empowered, and science backed. If you're ready to go deeper, if you have questions, go on my website, drfatlamandre.com. My book is there, PDFs, newsletter, and a link for consults if you need that. Until then, keep asking questions, keep asking for more, and keep disrupting.